was a wonderful experience at Wesleyan. It was a small college at that time, only 700 people. There were wonderful people in the Department of Biology who I became friends with after a very short period of time. I had a good education, and I learned a lot of idealism there, I think. It was pretty good at that time because we took exams, but there were no grades for a while, or you didn't see the grades. There were grades, I'm sure. So it was more relaxed than it might have been. It was a good school. The people who were in my class were terrific, and so it was a pleasant time there. When I was an intern, I probably was leaning towards surgery, and it was a rotating internship because that's the only kind they had in Pennsylvania at that time by law. So everybody took a rotating internship. It was a very competitive department at that particular time. It was pyramidal. It started out with 10 people, and it ended up with 2. And the 2s usually went out and became professors someplace. They're all famous people. When I got to Cleveland, it was a much different atmosphere. It was much more pleasant. It was although it wasn't a young school, they had a young faculty there, and there were people primarily who were interested in teaching. And so it was really a wonderful experience. When I was at Penn, they didn't have emergency room doctors in those days. The only person in the emergency room at Penn was the intern. For 6 weeks, I worked from 8 in the morning till 6 at night the following day for 6 weeks. It was an incredible experience to learn how to deal with sick people. But it was really something. But when that was done, one had a lot of confidence about knowing what to do in less intense situations, really. Well, Cleveland was a very important time because I did 3 years of medicine and then 2 years of hematology. And the third year I took in medicine, I had a lot of cardiology, and I went out and spent 6 months with the Hutterites in Montana and Alberta helping a geneticist. I did the physical examinations. The anthropologist that was with me talked to the people. It was a wonderful experience. They're very much like the Amish, except they live in communes. So that was really a very nice experience. Scientifically, when I came back, I didn't have time to go back and write stuff on most of this, but it was a nice experience. One of my best friends in medical school was John Benzel, who was from Wilmington, and he was practicing in Delaware hematology. And I knew that because I had actually, in those days, there wasn't a Xerox or anything. So if you saw an interesting article, you sent a card to the guy who did the paper, and he sent you a copy. So there was one of those things that I sent to Walter Reed, and John was there, and he wrote me a letter back, so I knew he was in hematology as well. So when I was at Valley Forge, he was back in Delaware, and so we talked a lot, and we got together a number of times, and after a while, it turned out that they were looking for somebody to come, so that they wondered if I was interested. Well, John is a terrific guy, and that was a real plus. The other thing was that he had a partner, John Egan, who was the first hematologist in Wilmington, in Delaware, who's an absolutely remarkable guy. And it didn't take me but a few minutes when I met him to sort of realize that. So instead of going back to Cleveland, we stayed here. He really is what hematology is here. Really is all descended from him. The blood bank was one thing. He found a PhD at Jefferson who was interested in coagulation, who brought her down, and she set up a coagulation lab which was as good as any I've ever seen in academia. I mean, it was, so we had a really good laboratory. In 1965, in Atlantic City, where there was a very impressive group of people. It was sort of all academic medicine went there every first week in May. And when the gambling stuff came, it disappeared. And although the group is still around, it's much less significant than it was then. So there was a meeting down there. They discussed the survival of patients with acute leukemia. There were 100 people in the world who had survived more than a year at that particular time. That's acute leukemia. In 1970, there were sort of different recipes for how you treat people. It was more aggressive, and there was kids who have acute lymphocytic leukemia get it in their around their brain unless you do something, and somebody figured out what to do, which was to put drugs in through the spinal canal, and also to sometimes radiate and that all went away. So half the people who were in remission would have a relapse in their central nervous system. And so then it went down to less than 5%, something like that. So that was an incredible change. The kids always did better than the adults, and that was true for a long time, and it probably still, it is for a long time. Not because of being kids, but it's just that it's more difficult with adults. I mean, the diseases are much more difficult. This was a big change at that particular time, and was a real breakthrough in acute leukemia. When I came to town, the only really good library was at the Academy on Lovering Avenue there, and so you'd stop there on the way home or something to look up something, because the hospital libraries at that time weren't really as good as they are now. And it's a nice thing that they're all together now. That library and the hospital library are one.